Mr. Speaker, today's NDP have been mismanaging Manitoba's healthcare system ever since 1999.
You got that right.
The tragic ER-related deaths of people like Dorothy Madden, Brian Sinclair, and recently Heather Brennan are a horrible reminder of today's NDP government's mismanagement of the emergency rooms and the facilities around them. We have reports after reports. We have inquests after inquests. And yet this reactionary approach, the trademark of today's NDP, just can't seem to get it right. No. I ask the Premier, why has today's NDP government been so ineffectual in its approach to health care and emergency rooms in our province?
We've been actually quite proactive. We took the medical school enrollment from 70, which had been reduced under the members opposite, up to 110. So we've got 645 more doctors practicing in Manitoba. 107 graduated last week from the medical school program. We've increased the number of nurses in Manitoba by over 3,400. We've increased all the training opportunities all over Manitoba for nurses. And now when it comes to ERs, whereas the members opposite would not report publicly, every single day there is a website that shows the number of people that are waiting in ERs. And the number has dramatically reduced, Mr. Speaker, dramatically reduced. And there's a management process in place to ensure that people are in ERs as short a time as possible with respect to their healthcare needs. We have made very significant improvements, Mr. Speaker, and I can only repeat that the member opposite needs to examine the facts before he renders judgment, Mr. Speaker.
I see and others see the problems day after day, and maybe part of this is related to information systems too. 16 years of inefficient operations by today's NDP are unfortunately all too evident. Yep. They may think that amalgamating RHAs was a cost savings, but their lack of planning has left the new RHAs with multiple information systems that don't even communicate with one another. Nope. So that a healthcare professional in one part of an RHA is not easily able to access patient information in another part of the same RHA. Today's NDP has created, in essence, a Tower of Babel where information can't be shared. I ask the Premier, why has he created such a disorganized healthcare system where the parts, even one RHA, can't talk to one another?
There's a dramatic difference today than there was when we came into office. There was no information at all, Mr. Speaker. None was reported. Now we have daily reports and accountability. So how many people are in ERs, Mr. Speaker? There's an electronic health record now that never existed before. There's the ability to have telehealth in Manitoba now, Mr. Speaker, where a physician or a family practitioner in northern Manitoba and rural Manitoba can have direct access to a specialist and consult on the information that they've received through a diagnosis of their patients. There's been very significant investments in information technology in Manitoba, Mr. Speaker, and they will continue to build an infrastructure which will allow patients to have family physicians close to where they live. Those family physicians will then have access through electronic technology to specialists, and records and other forms of information will be able to be moved in a confidential way to get the best diagnosis for patients as quickly as possible, as close to where they live as possible, Mr. Speaker. And all of those investments, every single time, the member for River Heights has voted against them, Mr. Speaker.
And that's because this NDP system has had so many gaps, so much miscommunication. Look, an effective healthcare system should make the best use of information technology, like, for example, the Emergency Department Information System, known as EDIS, a standard across Canada and in developed countries around the world. Yep. Yet I table a FIPA, which shows that the Northern Health Authority doesn't even use EDIS. It is not transparent, as the minister is trying to claim. Indeed, the lack of this information system in Thompson makes it difficult to gather critical information needed to improve healthcare delivery, as the FIPA shows. I ask the Premier, why has the NDP, in 18 long years, consistently failed to ensure basic information systems
The
are
honourable
in place
member's time for this question has elapsed.
I thank the member opposite for the question, Mr. Speaker. There have been very significant investments in northern healthcare in Manitoba. There never used to be a time when people in First Nations would have access to dialysis treatment where they live. We have now, through innovative measures, put dialysis treatment in First Nations communities where they will get support close to where they live, so they don't have to jump on a plane to get dialysis treatment. We've supported personal care homes being built in First Nations communities, Mr. Speakers, in partners with the communities and the federal government. We have emergency medical evacuation systems which have been strengthened, Mr. Speaker, all throughout the province of Manitoba. And information technology, including telehealth, is now widely available throughout Manitoba. I've seen it in action, Mr. Speaker. It makes a huge difference. A physician now can work in a rural or northern community and not be isolated. They can have access to the best advice from their specialist colleagues anywhere in Manitoba when they need it through telehealth. These investments make a big difference. They keep people safe, they keep people at home, and they keep people healthy in their communities. That's exactly what we want, Mr. Speaker.